Hello, and welcome back. Today we're talking about a habit so common, most people don't think twice a trip to the emergency room. Plucking the hair out of your nose. It seems harmless. A quick tweeze, and it's gone. But what I'm about to share with you today is something every patient over 60 should know before they reach for those tweezers again. Stay with me, this could save you. First, let's understand why we even have hair inside our nose. Those hairs, called vibrissae, aren't just there by accident. They're your body's first line of defense against the outside world. Every breath you take pulls in dust, pollen, bacteria, and airborne particles. Nose hair traps a significant portion of that debris before it ever reaches your lungs. As we get older, nose hair often becomes longer and more visible, which is why so many people want it gone. But how you remove it matters far more than most realize. When you pluck a hair from inside your nose, you're not just removing the hair. You're creating an open wound at the base of the hair follicle, inside one of the warmest, moistest environments on your entire body. That follicle can become inflamed or infected, a condition called folliculitis. You may notice redness, tenderness, or a small, pimple-like bump just inside the nostril. For most people, this clears up on its own, but for some, particularly those with diabetes or weakened immune systems, it can progress into something more serious, a deeper infection called nasal vestibulitis, which can cause significant swelling, pain, and in rare cases, abscess formation. Here's the part most people have never heard, and it's the reason I wanted to make this video. The area surrounding your nose and upper lip is sometimes referred by doctors as the danger triangle of the face. The veins in this region drain differently than veins almost anywhere else on your body. Instead of only flowing toward your heart, some of these veins connect directly to a structure deep inside your skull called the cavernous sinus, a collection of veins that sits near your brain. Normally, this isn't a concern at all. But if a skin infection in this triangle becomes severe and isn't treated, bacteria can, in extremely rare cases, travel along these veins toward the brain. This can lead to a condition called cavernous sinus thrombosis, a serious and potentially life-threatening complication. I want to be very clear with you. This outcome is rare. The vast majority of people who pluck a nose hair will never experience anything beyond mild, temporary irritation. But rare is not impossible. And for an injury this easy to avoid, I'd rather you know the real risk than discover it the hard way. Certain people should be especially cautious. If you have diabetes, a weakened immune system, are on blood thinners, or have poor circulation, your body has a harder time. This is particularly important information. So what should you actually do if your nose hair bothers you? The safest option is trimming, not plucking. A small, rounded-tipped nose hair trimmer, the kind sold at any pharmacy, lets you shorten visible hair without creating a wound at the root. Trim regularly rather than infrequently. This keeps hair shorter overall and reduces the temptation to pluck. If you currently pluck and have never had a problem, I'm not telling you that you're in danger. I'm telling you that the safer long-term habit is trimming, and that if you ever notice a nose hair removal site become red, warm, increasingly painful, or swollen, especially with fever, that's your signal to call your doctor promptly rather than wait it out. To sum up, nose hair serves a real purpose. Plucking creates an open wound in a uniquely risky location on the face, and while serious complications are uncommon, a simple trimmer is a safer choice for nearly everyone, especially if you're managing diabetes, circulation issues, or a weaker immune system. If you found this helpful, give this video a thumbs up and subscribe for more practical health guidance explained clearly without the medical jargon. And as always, if something doesn't feel right with your body, don't wait. Call your doctor. Thank you for watching. See you.